Also having our three patients who were already treated under our doctors, and they will talk about their experience at Calcutta and clinical outcome. I would request Dr. Adil to take this forward with the case study, and we can call the patient on the dais.
Good morning. Thank you for having us here today. We in Manipal Hospital we have a setup which is very comprehensive for cancer care. We have a full functioning multi-specialty hospital just next door in the same premises, and that is an added benefit for the cancer patients if they are having some general health issues that can be addressed, that can be addressed with specialist care. In the oncology per se, we have we have organ specific clinics. Like there are various departments like uro-oncology, head and neck oncosurgery, gastro surgery, thoracic surgery. We have special state of the art laboratory facilities where we have high end molecular diagnostics. We have a full fledged functioning nuclear medicine department. We have a good radiology setup. And along with this, there is a what is most important in our cancer care is multi-speciality approach. So we have very regular tumor boards happening, and we discuss amongst ourselves case to case. We have the surgeons, we have the medical oncologists, we have the radiation oncologists, we have the imaging people, we have the pathologists. So we sit together, we take the case up, we discuss it, and then we finalize a strategy how to address that case further. So there are a couple of patients that we have treated from this part of the country. Mizoram, we had a recent tie-up with the Mizoram government, and then we are getting patients from this part of means Mizoram and the northeast. And we have treated few of the meso patients, and one or two patients are here with us today to tell you about their experience in Kolkata. We have a very good young girl, Zamin Mavi. She came with a thyroid cancer, operated, and then came to me for a radioiodine therapy. Her She was in stage one. The cancer was in very early stage. We did the investigations, the whole body scan, and few blood tests. And depending upon those results, we took her up for radioiodine therapy. She's doing well, and she's here to speak about her experience in Kolkata. I'll invite Ms. Zamin Mavi here to say a few words. Please.
Please come, ma'am.
nikum nikum khanin I sibila I thyroid lam hai sana wangi ken entira chuan chuta chuanin damdoi te min cho in zei ka to ka thyroid be lam pang hi zei nga yan tia chama se an zei khanin FNSC ten ti a te sen ti khanin cancer ni lo an ti a wanga zei khan ya be lam pang an pe ya chuan chumi chu I biopsy te kan la a biopsy result atang khanin cancer ni ti kha hmu swale ni a Mizoramah ke mani bi thyroid cancer how papillary thyroid how bi kha chu treatment awm lo wangin I phailama te min refer angai ta chuan chu sota zema bok lama tangin doctor min refer a I Kolkata lama chuan khulama I August nili khanin kan chuk tha I adukan min admit ngalin I investigation sang tang ti hnuin an mani how chanin I an pei lo lam le lampang pei le turan ti wa khanin avai khanin an pei ta chuan chumi chuanin I a cancer ber an pei to hnu kha chuanin biso chuanin kan lo I lo thon deu thin chu a le pe ko omangem ti te adanga te a lo kai te rangem ti te kha shiat an du ta chumi chu investigation an ti hnu khanin hetia angte heta chuanin chemo ang pon ati theya ni la pon radiation pa nga yang pon ati theya an te ama se an mani bi chuanin inglo radioactive iodine therapy kha la turin in tia chu chuanin khata thyroid ta an pei zol lo te alo la chambang om zong zong khami soi tu khanin treatment in lak tira chuan treatment kalak zo hnu in isolation te kan neya chuan chumi chu a him an ti hnuwa ka ron hon heta khong dia chuan thanga hnuwa tuna hianin in check up le turan ti ta doctor ten chuan chumi hma chuan hei treatment kan nei atanga tu thleng hian engmah hasan ai mem kan nei lawa keima pawh chuanin ril ru ti hadam nan hrim treatment te pawh la kan nia a tul wang pawh ni tho bawk ma sela tu thleng hianin keima chuanin a effective ka ti lame.
Thank you. Pooja Agarwal to speak a few words, and we'll take few patients.
I'm a breast surgeon at Manipal Hospital, Canada. So October is a breast cancer awareness month. This month, we encourage all women above the age of 40 to undergo yearly mammogram. Breast cancer is rising in our country, and we see a lot of young girls also suffering from breast cancer. I take this opportunity to encourage all girls to check their breast for any breast lump. Mizoramah has a very high population of girls suffering from breast cancer. It is very relevant and it is very important for them to know their breast and if they see any problem to visit a doctor. Recently, we have treated two patients, two very nice young girls, and they are here with us today. One of them has been treated and she is doing well now, and one is still undergoing treatment. And I think it would be better if they talk about their journey with all of you. Juliet, Ron, please come. Yeah. Introduce.
Sibai ule kaming chu Juliet Lalruat moi ralte ani atuna hian kumsum ti pariat kani ka hnute beilam hi cancer ani kumin March kha khanin civil hospital a kanin entira chuta chuanin bo ka oma FNSC a khanin cancer anti amaro chu biopsy te kan la khanin cancer ani lo anti le awang khanin boili biopsy kan la a khami lu khanin cancer ani lo anti awang khanin kan zaita khani a chuan thathum hnu ka in check up khanin ultrasound te kan han ti leu ne hnu khanin cancer ani ti kha an hu chuak le a chu heta khoi ve ka ngai anti awang khanin ka du bo lawa chu doctor te bula khanin min refer me ro ka ti a chuanin Kolkata medical super specialty hospital hi heta hianin min refer kan thlen thak pu ka chang khanin ti khanin investigation chang te kan han ti chawa amun chim ku kan soi lu ka nga ku ta khanin engkim hi a fel vel ve ka khol mun dang pan ngai mi alin hospital chunga khanin na om ve ka keimani tam lo te patient te kha wheelchair in te khanin min nor ve ka keimani ha ngai mi alo khan engkim kha ahun taka ve khanin min ti saka patient te min wat em abikin doctor Pooja hi ka fakdu a chan chu a patient te min enge a hospitality a chalut to ka min care em ama ber hianin enge kan results ang chi te po te khanin a doctor bersi kha aphar dor te khop khanin he min ngai to em ani chu kulaya enge a thok tu te zong ti mayang he chhuat no thang kha an travel veka til a champlung box si a enge dam lo tan chan a ha dam thak lu ka mel shat dam te tyang anga cancer abanga lo boy chaumek te po hianin pan be nge se ti kha ka tu sapui em tu na po hianin ke ma po hian ka chat pui em doctor te mani se phone call te message thlengin ti hianin direct in kan be thei vek boka he a chat em na ni booking ka sha chu zung chu ka sai thei ni ra se kalome
Kami jual rumah sekalian dia. Kum tira trong khan dia. ZMC hospital apa itu tira. Itu dia bila macam bila macam yang dia swab China. Tuan ultrasound le itu trong kan dia itu civil atai dia ultrasound ala. Enggak tu dia lawa doktorin. Min saya thadlaw na mesti nak lawa. Tuan MRI dia ngai dia isola dia di sini lawa. Ta medica ayan min refera medica MRI min te saka ela ma that lo na lo nuala an ta hi se ya na kadam to an hospital ko an station simila mi an hai kwa tha in ma hi mani wat we ngai mani in wat we ai lo mi in wat we tha doctor buzai pe so me se sian te be wai na se me ma lo chang mal zung so ma fe le me ma
tiang ai in pol na thai hi tiang a thu tiang ki om lo ti ga ro sui du shim shim ni
As well to also attend the IMA program, which has been held by IMA Mizoram State Branch to celebrate October Breast Cancer Awareness Month. So this has held at Aizol Club, and there was a participation of more than 100 doctors, and including our speaker, who has make them understand that the way they call it as a continuous professional progress program. And in future also, we are going to do some screening program for the cancer in Aizawl and as well as in Mizoram. I also would like to mention that Medica or Manipal Hospital right now, there are 4 branches in Calcutta. Mostly the cancer patients are going to Medica, which is known as Manipal Hospital EM Bypass, and Salt Lake Amri Hospital, which is known as Manipal Broadway. As of now, since April 2025, we have treated more than 300 patients from Mizoram from all the disciplines. Every month, we usually get around 30 to 35 patients from Mizoram referred cases for surgical and non-surgical cases. Right now, Mizoram is focusing for the cancer awareness program because of the October, as well as in future also, we are also having planned to do some OPD in our one of the setup in Aizawl that we are looking into it. I would request Pooja ma'am to talk about some breast cancer awareness program which we have focused yesterday, and what exactly the significance of this program, and make them people aware that prevention is better than cure.
So, like we said yesterday in the program, Mizoram has a very high incidence of breast cancer. So, it is very important for all the women in our state to know their breast, to check for any breast lump. It is very important. Every month, they should do a self examination, and a woman above the age of 40 should undergo a mammogram. Catching the disease is very early for a good treatment and a good survival. We want to treat early disease for the best prognosis. So please be very mindful. If you feel any change in your breast, if you see there is any change which was not there before, please go and talk to your doctor. Breast cancer is very well treatable. Okay, so very until unless it is metastatic disease, the cancer is spread to other parts of your body. A patient can live a very nice, happy, fulfilling life for a very long time. So we want to catch the disease early so as to give a good treatment. So please know the signs and symptoms, talk to your doctor about it, do self-examination, do yearly mammogram, and if you feel something abnormal in your breast, visit a doctor. Throughout the year, this screening and this awareness about cancer should go on, not only in just that month, which is about that cancer particularly. So, October is celebrated as Breast Cancer Awareness Month. Please, we request all women to get a mammogram if you are above the age of 40. Thank you.
Since October is the Breast Cancer Awareness Month, I will request Dr. Adil Adnan, who is the head of the department of nuclear medicine, what exactly the main role can play to cure a patient from breast cancer by the nuclear medicine treatment.
So generally, in a breast cancer treatment, nuclear medicine helps in catching the disease, and how much it has spread into the body. Most of the times, the patient, once they experience any problem, any irregularity, they will visit the doctor. The initial investigations being ultrasound and a mammogram, and followed by a biopsy or FNSC. Then a histopathological examination of is done on that biopsy sample. We get to know what the disease is. So there are several types of breast carcinoma. There's ductal, infiltrative, medullary, and many others. So once a diagnosis is established, it is very essential in a cancer patient to know in what stage the disease is, so as to tailor the specific treatment. Suppose it is stage 1, very early, no lymph nodes, patient can go for a surgery depending upon the size of the lesion. Otherwise, if it is the size is more than 4 or 5 centimeter, or there are few lymph nodes, then the ideal thing is to first the patient goes for a chemotherapy, and then when there is a reduction in the size of the lesion and the lymph nodes, then the patient is taken for a surgery. So to determine the stage, nuclear medicine is very important. We do a FDG PET CT scan in the patients, and which shows us the breast lesion and what other parts of body are affected from it. So to see the stage of the disease and to tailor the specific treatment, we there is a role of nuclear medicine. Once the treatment starts, then we have to know what is the treatment response. For that, we do the scan again and see how much the reduction in size has happened, and whether the patient can now be taken for surgery or not. And in a case where there is a spread, patient is not a case for surgery. She is taken for chemotherapy or radiotherapy, or there are different targeted therapies available these days. So, in that setting, to assess the response to treatment, we use FDG PET scan, and there are many other PET scans which are now being available. Some are in the experimental stage, and that is mainly the role of nuclear medicine is to set the stage, check the stage, number one. Second, to see the treatment response, and if the patient is completely cured, then at regular intervals we do these scans to see whether there is any recurrence or not.
Thank you, sir. I will conclude the discussion with that to mention that I'm coming to Mizoram since last 15 years, and I've seen the significant changes of the medical services in Mizoram. In 2010 or 2009, when usually come, then we see only 3 or 4 to the hospital. Right now, I think it is more than 10 or 15 hospitals. Those are serving total 6 or 7 times population. So I must say that the number of referred cases to outside state going in 2010 is now very less because these hospital, not only the private hospitals, ZMC is there, the regional cancer hospital is there, civil hospital Lunglei, civil hospital Aizwal, they are playing a very significant role to take care of their citizens. And definitely, Manipal is always there to support them for any training purpose or anything in future. Thank you. Thank you for having us here today. Thanks.